Mr. Paulsen.
Thank you, Mr. Chairman, and Madam Secretary, thanks for being here. You know, Americans needed real health care reform before the President signed the new health care law, and the fact is they still need it today. The more we learn about the President's new health care law, I think the more the facts show it's hurting more people than it's actually helping. I'm hearing from constituents on a fairly regular basis right now who are genuinely concerned. Many are upset, many are confused because of the different delays in parts of the law. And they're fearful. They're fearful about the cost to their pocketbooks for increased health care costs for themselves and their families. And instead of getting what the President, I think, promised when it was rolled out for having lower premiums and lower costs, many are now paying more for health care. Significantly higher deductibles, more expensive premiums. Many have lost their insurance, the plans that they liked or the plans that they had. Many have fewer choices now for doctors and for their plans, and there's no doubt that some companies have been forced to scale back hours with more part-time jobs and less full-time jobs. And so those employees that had good full-time jobs now have part-time jobs. And there are jobs that are being lost. I know the medical device tax was a central component for the revenue stream of the Affordable Care Act, but we got 33,000 jobs now that have been estimated to have been lost in this industry. And this is one of our best American success stories. This is where health innovations come from to help patients. And I've got 51,000 seniors in my district that are part of that Medicare Advantage population. And some of the past cuts in the MA program and some of the proposed cuts are certainly giving them concern for losing benefits or maybe even losing some of their plans. And I think, Madam Secretary, the irony in all this is that in Minnesota, a state like Minnesota, where we had one of the lowest uninsured rates before the law was put into place, we're actually likely to see an increase in the uninsured number now because the law eliminated a lot of the reforms successfully that had been implemented in a state like Minnesota. So my question, Madam Secretary, is why should the administration, as a part of your budget request, get another $1.8 billion for the exchanges, for all the other programs that are associated with the rollout of Obamacare?
Well, again, Congressman, I think that the evidence out with the recent health survey in the last 2 days indicates that the overall uninsured rate in this country is actually going down. So more people have insurance coverage, according to the survey, than did before this law was passed. So the evidence says that this actually is making an impact and a positive impact. I would also say that the vast majority of Americans have coverage through their workplaces, and that coverage over the last 3 years has gotten stronger. There are more consumer protections, so they can't be they don't have an annual cap anymore, and they can't run out of treatment during chemotherapy. They have some features that they didn't have before, but that's in place. Medicare has gotten stronger with this plan. There are additional people who now have Medicaid benefits, and the individual market.
Can I just ask one more question? Do you expect health care premiums to increase again next year on average? Will they go up? Because they certainly went up for a lot of folks this year, but do you expect that trend to continue next year again?
I think premiums are likely to go up, but go up at a smaller pace in what we've seen since 2010. The increases are far less significant than they were prior to the passage of the Affordable Care Act. Yes, sir.